Welcome to today's presentation, Robust Validation and User Acceptance Testing Best Practices for your IRT. Hello, and thank you for joining today. My name is Andy DiStefano, Director of Project Management at Veracity Logic. I have been in the biotech industry for 15 years and recently earned the ACRP Certified Professional Credential. I have a bachelor's degree in management and a certificate in clinical research organizational management. Before I get started, I would like to survey the audience to find out how familiar you are with validation and/or user acceptance testing. Would you all take a minute to respond to the survey response link on your screen and make your selection now? Validation and user acceptance testing are the most important steps before releasing an IRT into production, as this is your gauge as to how the IRT will perform in the production environment. We hope you will find these topics interesting and relevant. Here's what we will cover today. What is the difference between validation and user acceptance testing? What are the steps involved in validation? What are the steps involved in user acceptance testing? And what are the required documentation and some examples for you today? There will be time after the webinar for questions and how to stop by our virtual booth and how to reach us directly. Here is a high-level comparison of validation and user acceptance testing. Validation is performed by the vendor, and the documentation must be framed around the project specifications document. Whereas user acceptance testing is performed by the CRO and/or sponsor, and this documentation is typically framed around the user requirement specification. The namings of these documents may differ between vendors. Typically, there will be a user requirement specification, which is written in a more general, easy to understand fashion from the end user's perspective. The document, which is in more technical format, is there to meet the needs of the programmers. The vendor may refer to this document as a project specification, functional specifications, or technical document. Validation is a process that will ensure the completeness of the system in achieving the functional requirements and configuration parameters, and provides evidence of system testing and traceability back to the functional requirements. Typically, the IRT vendor will have a validated core system. Many sponsors will require a qualification audit of the vendor's core system or the project itself, but before the IRT system for the specific study can be released into production. For a project-specific implementation based on the validated core, the IRT vendor will perform additional detailed and documented testing designed to provide confidence that the system meets the stated project requirements. This additional validation will include positive and negative testing, functionality of customizations, and any items deemed to be high risk, such as randomization and assignment of investigative product to the subjects. For additional information on the industry's validation requirements, please check out the links to the FDA and the European Union Medicines Agency website on the bottom of this page. User acceptance testing is independent of the IRT's vendor's testing and is intended to confirm that the system meets the needs of the study. It is detailed and documented. The focus is on real-life scenarios that follow the study workflow. You should leverage your vendor's testing so that you don't repeat their tests. This can reduce the amount of time you need for your user acceptance testing. Each test needs to include a link between the test and the section of the user requirement specifications that is being tested. When possible, end users should participate in the user acceptance testing to ensure that all intended users' perspectives are considered. Let's take a look at how the IRT vendor goes through the validation process. The validation plan provides an overview of the validation process utilized by the vendor for internal testing of the project-specific implementation of the IRT system, and outlines the steps taken to ensure that all of the requested functionality is not only included in the system, but that it is functioning correctly. Here is a list of some of the items included in the validation plan. The validation team members' names, their titles and roles in the process, a list of project documents included in validation, administrative procedures such as risk assessment, testing instructions, and anomaly and resolution reporting, a list of test scripts, and the trace matrix, which proves that each requirement in the functional requirements has been tested. The following slide will show a detailed look at a table of contents for a validation plan. This slide shows the level of detail which is needed amongst the sections to demonstrate a well-constructed plan, which is needed to demonstrate the quality of the IRT. It starts off with the scope of the plan, all of the processes required during validation, and ends with the approval section. Following the validation plan comes the testing by the validation team. The tester must follow the action listed in each step of the test script. If the expected result is achieved, the step can be passed, and the next action can be executed. If an expected result is not achieved, then the step needs to be failed and reported so it can be fixed by the programmer. Let's walk through an actual validation test script. This slide shows an example of an actual validation test case. It starts with the notes or instructions at the top of the page. It includes revision history and then moves on to the purpose or objective of the test case. In this example, I have gone ahead and populated the blank lines which the validation associate would need to complete. This script is testing whether the system will enforce the correct age range, in this case, between 18 and 65 years. For example, on step 6, it asks the tester to try to enter an age outside of the valid age range. If the test is successful, the tester will not be able to screen the subject, which is written in the action column as well as the expected result column. Then the tester is able to indicate the step passed. In the following steps, the tester goes on to attempt different actions and achieve the expected results. The last page is a summary page indicating which steps passed and/or failed. The tester will sign indicating the completion of the test, and if all the steps pass, then the validation team will approve and sign as well. If any of the steps do not pass, the vendor has a process to report the issues back to the programmer who will resolve the issue. Then the step will be rerun in the next test cycle. After all of the test scripts have been executed and all of the steps passed, the validation team will create the validation summary report. Here are some of the items included in the validation summary report: the number of test cycles, the dates of testing, the results of each test cycle, and this also includes a description of each error found and how it was resolved or fixed. The approval page of the validation summary report acts as a certificate documenting that the system was tested according to the specifications and the system is ready for the client to perform their user acceptance testing. Now we will switch gears and talk about user acceptance testing process. We'll start with reviewing the user requirement specification and the vendor's planned test cases and verification documents. Make a list of the user requirement specification sections which need to be tested. Create your test plan. A standard table format is sufficient. Next is drafting your test cases. Review your vendor's executed tests. Adjust your plan if necessary. Execute your test cases. And then write your user acceptance testing summary report. And again, a standard table format is sufficient. Here is a way to think about user acceptance testing. Test cases should be written with the following in mind: functions that users are able to perform, such as screening a subject, and rules for the system to follow, such as checking that a new subject's age is within a specified range for the study and issuing a warning if it is not. Let's continue on with the age range example. If the protocol indicates the age range is 18 to 65, then you will want to make sure that only subjects screened within that range get screened. The steps to test this rule when screening a new subject are: for the in-range test, enter the first subject with the age of 18. Your expected result is that the subject will be added to the system as screened. Go ahead and enter a second subject with the age of 65. Your expected result is that the subject will also be added to the system as screened. For your out-of-range test, enter a third subject with the age of 17. So your expected result would be that a warning is generated by the system stating that the subject's age is outside the expected range and cannot be screened. Go ahead and enter a fourth subject with the age of 66. Again, the same expected result is that a warning is generated by the system that the subject's age is outside the expected range and cannot be screened. A user acceptance test script should include actions for the tester, which sections of the user requirements are being tested, expected results, actual results, and a column to indicate the step passed or failed. This is an example of an actual user acceptance test case. At first glance, it may look similar to the validation test case we reviewed earlier. It starts with the notes or instructions at the top of the page. As you get further down, you will notice that there is a reference to the user requirement specification. We did not see this in the validation test case, as the validation test case steps are documented differently, primarily using the trace matrix. The user acceptance test case also includes revision history and the purpose or objective of the test case. In this example, I have gone ahead and populated the blank lines which the user acceptance tester will need to complete. This script is testing whether the system will enforce the correct age range, in this case, between 18 and 65 years. For example, on step 5 and 6, it asks the tester to try to enter an age between 18 and 65. If the test is successful, the tester will be able to screen the subject. This is written in the action column as well as the expected result column, and the tester is able to indicate that the step has passed. The tester goes on to complete the remaining test steps and achieve the expected results. The last page is a summary page indicating which steps passed and/or failed. The tester will sign indicating the completion of the test. If any of the steps do not pass, the tester should communicate the test step which did not pass back to the vendor, who will try to duplicate the issue. If it is in fact a true system issue, the programmer will resolve the issue. Then the step will be rerun in the next test cycle. Depending on your company's SOPs, your quality assurance department may also require screen prints of some or all of the steps and an extra signatory line for their reviewer's signature. Please take the time to review the vendor's test cases. You do not want to repeat the testing that was done by the vendor, but you do want to test that all user functions perform as meeting your project's expectations. The objective is, say what you're going to do it, and show that you did it. This is accomplished by creating a test plan, executing the plan, and creating a user acceptance testing summary report describing the results of your testing. Study audits can occur during the course of the study or after it concludes. At a minimum, the following fully executed documents should be ready for inspection: the user requirement specification, your testing plan, your executed test cases, and the user acceptance testing summary report. If you have any questions, please be sure to submit them using the chat button on your screen or stop by our booth. If you stop by our booth, you will be entered in the drawing to win $100 donated to the charity of your choice. Copies of this presentation are available to you on the Outsourcing in Clinical Trials Southeast webinar platform. If you would like a complimentary handout called the Veracity Logic Guide to User Acceptance Testing, which provides a more in-depth, detailed description of user acceptance testing process, please email me, Andy@veracitylogic.com, or David@veracitylogic.com. Thank you for attending today's presentation.